general approaches to treatment before we get into the more specific treatment that we're going to do when we see the anxiety from complex trauma. So Dr. John Briere, talks a lot about kind of utilizing some CBT, relational and mindful principles to support the processing of traumatic memories through titrated exposure. You might do that in something like EMDR. Changes in the client's relationship to trauma-related thoughts and feelings, the development of increased affect regulation capacities, so somatic methods, and the reworking of activated relational schema and other implicit memories. So we think of schema as essentially patterns of thinking that organize and understand information. For individuals who have dealt with complex trauma, their schema, it's completely skewed. So they may think, okay, well maybe someone lost their mother when they were 5 years old, and for them it means, well, if I love someone, they're going to abandon me. And that's their schema in their mind, and then they organize their self and their relationships around that fear and around that belief system, and that's where we see the fallout, and we have to help correct that schema. We're not going to go into all of this just because of time, but it's a beautiful glimpse at the stages of complex trauma recovery. So in a nutshell, a lot of the work initially, we're working on what we call resourcing and safety. And again, we're going to get into how that safety looks a lot different actually in complex trauma. But education, stabilization, safety, building out their resources internally and externally. When that's in place, and it may take a very long time for that to be in place. This person may have dealt with 20 years of complex trauma, and someone once said you can't kind of walk 20 miles into a forest and get out in a mile. It's going to take what it takes. So the stage 2, that's going to be where they're going to be doing more of the processing, remembering, mourning, going through what happened and how they understand it, how it affected them, and how they're going to create meaning out of it. And that's the 3rd stage, meaning and reconnection. So again, this could be a whole presentation in and of itself. But what I love about what Judith Herman says, and she's done incredible work in this field, is she says, recovery can take place only within the context of relationships. And so you're going to hear me say it a lot, that it's the relationship, it's the connection, it's the attachment. All the tools in the world fall flat when we don't have that. The individual hasn't had a safe connection, so when they can act out in the therapy room or feel parts of themselves that they feel are so shameful or bad, and you don't go running out of the room, you're doing so much already. I tell my clients sometimes it's like you putting all your guts out on the floor, everything you're terrified of, all parts of you, and taking the most horrific fluorescent light and shining it on there, and we're owning it. And not in a way that we're going to give it permission to hang around and to be in the driver's seat, but in a way of like, yeah, this happened. We can't change it. It wasn't okay. But how do I integrate it back into my life so that I can move forward in a way that I can harness whatever meaning, whatever power that I get from it? So I love Judith Herman's work around that. And again, this is just it's a lot. Again, I have issues with, so much let's just stay for the day. We'll just, hang out, order pizza. No. I always have this intention, I'm like, I'll just kind of pick out 3 parts and then I'm flooding you, but then we'll do like co-regulation and we'll be good. So, see, it's like in vivo training. So, but yes. It's that neurosequential model. So it's essentially ways, I love it because it's these tools of when we can, and this is specifically with children, but we can adapt it for adults because we know when is the child or the adult in there, like we looked at earlier, their lower brain and they're in fight or flight or freeze, and we know we either have to down-regulate or up-regulate, and that's gonna help us steer our intervention where it needs to go. In my mind, we've done a disservice to our field in how we've talked about, for example, borderline personality disorder. And I talked about this in another one of my trainings. I remember being in grad school and I read in a textbook about, I think the quote was, a borderline personality disorder client is a therapist's worst nightmare. And even then, I remember thinking like, oh God, that's terrible. Like, how does the individual feel that's, that you're judging them and putting this kind of dark just judgment on them, right? And I think it's getting better. I don't know, but that's why I like to have these conversations, because the individuals I work with, and there can be a lot of overlap between complex trauma and what we see as BPD, and they have learned those behaviors because of what happened to them. Those behaviors at one time had a function, had a purpose. They needed them to feel safe, to survive, to feel worthy, to navigate what may have been a highly abusive, narcissistic, chaotic environment, just like the quote we started with, right? Getting so little love, needing to be so lovely to get it, and so angry that you have to be so lovely. There's the chaos. There's those tentacles kind of seeping into every part. So I think when we can look at, and Dr. Gabor Mate does this, beautifully. He does great work. Well, I think he does great work. Non-pathologizing view of let's look at why, the function of this. Where does this come from? Why was this once necessary? And let's honor that, not in a way that, again, puts it in the driver's seat, but that we can say, I see you, I get it, I understand, that makes sense. Now let's do something different because it's killing you. Deep into to understand how that guides interventions. So this is where we're going to talk more. I found that image, and I was searching for an image that in my mind captured this difference, how the anxiety from complex trauma is different, and it's obviously a disturbing image, but this is disturbing. So obviously the anxiety from complex trauma is different. The treatment and regulation needed for this anxiety is different. There was a great article, and some of you may have come across it, but it talks about how we can't keep treating it the same way, and why. It's because someone dealing with anxiety, let's say from generalized anxiety disorder, they're often obsessing about something that could happen, and the anxiety they feel may not feel rational, and it can often be calmed with grounding techniques, reminders of what is real and true, the classic reality testing. Do you have evidence for that? Let's just take a breath, let's hit the pause button, all the grounding techniques. Mindfulness techniques can help. Even when they feel disconnected, generally anxious people can often acknowledge that they are loved and supported by others. For those who've experienced trauma, specifically complex trauma, the anxiety comes from an automatic physiological response to what has already happened. That's the difference here. So the brain and body knows what they've already lived through it. They know the worst case scenario. They know what it feels like and are hell-bent on never going back there again. So the fight, attachment, and community. And it's an article called The Rwandan Prescription for Depression, which is sun, drum, dance, and community. And it was an interview with Andrew Solomon, who many of you may have heard his TED Talk or his work with depression. And this was a Rwandan talking to him about what happened after the Rwandan genocide. We had a lot of trouble with Western mental health workers who came here immediately after the genocide, and we had to ask some of them to leave. They came, and their practice did not involve being outside in the sun where you begin to feel better. There was no music. I do realize that I'm kind of saying everything I just said. I don't know, but I'm doing it on purpose. There was no music or drumming to get your blood flowing again. There was no sense that everyone had taken the day off so that the entire community could come back together to try to lift you up and bring you back to joy. There was no acknowledgement of the depression as something invasive and external that could actually be cast out again. Instead, they would take people one at a time into these dingy little rooms and have them sit around for an hour or so and talk about bad things that had happened to them. We had to ask them to leave. I know. So I wrap up with that. Why? Not because we're doing everything wrong, but there's something beautiful to be said about thinking outside the box, remembering the power of connection, remembering the power of being outside and community, and not getting so caught up in our culture, which is like, fix it, fix me, make this better. Do you know the latest technique? And again, not dismissing that. It's important. We need to know what we're doing and be informed clinicians and have a treatment plan. But the power of relationship, all of complex trauma starts with wounds to attachment. And so I just thought this was a beautiful reminder of the importance of connection and community. And that's all I have. Thank you.